Hi, I'm Mr. Maciej Pawlak, Consultant General Surgeon at Rosshall Hospital, part of Circle Health Group. One condition I see very often in my clinic is hernias, and today I'm going to look in detail at the most common type of hernia, which is an inguinal hernia. I'll explain what causes an inguinal hernia, and I will talk through common symptoms of an inguinal hernia, as well as treatment options, including hernia surgery. So let's get into it. What is an inguinal hernia? An inguinal hernia occurs when a part of the body, typically a fatty tissue or a loop of bowel, protrudes through a weak spot in the muscles of the lower abdomen, near your groin. This creates a visible or sometimes uncomfortable bulge in the groin area, which might become more noticeable when standing, lifting, or coughing. It's actually the most common type of hernia, especially in men. Around 1 in 4 men will develop an inguinal hernia during their lifetime, although women can also be affected. What causes an inguinal hernia? There are a few reasons why an inguinal hernia can develop. Sometimes it's simply due to natural aging and the weakening of muscles over time. At other times, it can be linked to long-term straining, such as heavy lifting, chronic coughing, constipation, or urinary issues. Some people are also genetically more prone to have a hernia or have a family history of hernias. If you have had abdominal surgery in the past, or your work involves lots of physical effort, your risk might be higher. What are the symptoms of an inguinal hernia? The most typical symptom of an inguinal hernia is a bulge in the groin, which may appear on one or both sides. You might notice a dragging or aching sensation, particularly after activity or at the end of the day. The bulge often disappears when you lie down. In more advanced cases, it can be painful, especially when coughing, sneezing, or straining. In rare situations, a hernia can become trapped, which can be dangerous and require medical attention. If you notice any of these symptoms, it's a good idea to get checked, either by your GP or by a specialist like myself. What are the treatment options for an inguinal hernia? The key thing to know is that hernias don't go away on their own. While some people can manage minor symptoms for a while, surgery is the only way to truly repair a hernia and prevent it from getting worse. At Rosshall, we offer individualized treatment plans based on your symptoms, lifestyle, and preferences. We follow international guidelines which support surgical repair in symptomatic patients, especially where the hernia is causing pain, interfering your daily life, daily activities, or has a risk of complications. At Circle Health Group, we offer individualized treatment plans based on your symptoms, lifestyle, and preferences. We'll follow a holistic approach and take the time to understand you, your goals, and what caused your hernia. We'll put together a surgical plan to get you back to what you love doing quickly. What happens during hernia surgery? The goal of hernia surgery is to gently push the tissue back into place and strengthen the weak area in your abdominal wall. This is usually done with the help of surgical mesh, which acts like an internal support to reduce the chance of the hernia coming back. There are different approaches: open surgery with one large incision or minimally invasive keyhole surgery, also known as laparoscopic or robotic assisted surgery. The choice depends on many factors, including size of the hernia, your general health, and sometimes your previous surgical history. What is robotic hernia surgery? Robotic hernia surgery using Da Vinci robotic system is the most advanced form of minimally invasive repair. Robotic surgery allows your surgeon to operate through tiny incisions with even greater precision and control. This can mean less pain after surgery, lower risk of complications, smaller scars, and faster return to normal life. Robotic surgery is particularly useful in more complex cases. For example, where patients have had previous surgery, or we are dealing with recurrent hernias or hernias on both sides. but it's also an excellent option for many standard inguinal hernia repairs. Thank you for watching this video. If you have any more questions about inguinal hernias or anything else I've talked about, leave them in the comments section below and we'll get back to you. If you would like to arrange consultation to discuss your potential surgery, you can book an appointment with me or another consultant in your area at circlehealthgroup.co.uk. Thanks for watching.